I think probably the most unique part of what I provide with Baptist Operation Outreach is the relationship building with the homeless patients. You not only get an opportunity to help them physically, but you get an opportunity to build relationships with the patients, to talk to them about the hardships and the difficulties that they're going through, to take the time to pray with them, be encouraging to them while they're going through all the hard times. And it's just different. You know, if in a regular clinic or in a hospital setting, you see those patients and you may never see them again. Of course, our hope is to see a patient and never see them again because things have gotten better, but that is not always the case for the patients that we see. Some of the patients I've been servicing through the homeless program we've been seeing for years due to the hardships, due to their mental status sometimes, due to whatever different hardships they're having. Many of these patients are patients that we provide health care for a long, long time.
I had addiction and I was trying to seek some help, but I ain't had no ID, no insurance. So everywhere I went, the doors was closed. And they sent me to 201. After that, they sent me to mental health. So when I left mental health, I went straight to the mission. And that's when I met the mobile van and Miss J and them. And they started telling me about checkups. And I got my checkup all the time. And I got in that drug and alcohol program. And Miss Jan kept telling me, I always make my appointments and go to the van. And I was a little nervous about that, because really I ain't like no needles. I didn't like no doctors. I really didn't like strange people. You know, I was sort of to myself. But they had me so relaxed. I just got used to it and kept going to them. They helped me with a lot of stuff. You know, they gave me a lot of encouragement about you need to go with your checkups. And you know, they Christians. You know, because they pray. I was like, these folks praying for me and don't even know me. I said, it's cool. They must really care.
Well, this new clinic is a stationary site. The mobile clinic for the past 14 years, our goal was to take the healthcare to the people. So since 2004, we have done that and done it successfully in getting out in the community and taking the healthcare to the people. This particular site now is a location for healthcare, so that means we have exam rooms available so that the physicians can physically be in the building and provide total primary healthcare to our homeless patients.
Being on the streets in Mississippi and living the life I live as a drug-addicted person, I didn't know too much about my health and stuff. And so the mobile van used to come every Monday down to the mission. And I signed up and saw Miss Jan. I found out I was hypertension, blood pressure, and I started receiving treatment then. When I would see the doctor or the nurses, they always offer prayer. They would talk to me about God, and they would always encourage me to do better with my life. You know, they would always speak positive things into my life. And one thing, Miss Jan, she been more than just a nurse and a caregiver. She been a friend, you know, with certain situations that it came up with my life, and I asked for advice. She would be willing to give me advice. She always helped me with seeking other help with my homeless situation and stuff.
They have taken care of me since day one. I love them. I have had some mental issues. They have sent me to specialists for my mental issues, and they helped me with some homeless issues. If I need any food or clothing or anything, they make sure I go in the right direction for that. Some things that I might not even want to say anything about, they talk to me about it and just make me feel free to say anything that's needed and wanted that they can help me with.
Our goal is to see more homeless patients and to expand the program. The operations of the mobile van, we still will continue to go to Memphis Union Mission, to St. Mary's Episcopal, and also to Office of Reentry on Mississippi Boulevard. But one of our other goals with the mobile clinic is to build new relationships and have new agreements for the homeless organizations to provide health care.